Hi there, I'm Dr. Stephen Phelan. I have a question for you. Would you like to learn a very simple technique that could make your veneer provisionals, or really any other provisionals, go from looking like this, which is pretty good, really pretty good, but instead make them look like this, which is stunning. You know, a beautiful surface finish, looks like porcelain, really. Patients tell me when they come back for their provisional check appointment that nobody knows that they're not the final veneers because they look so good. And this is a huge practice builder. So I'd like to share with you a video from a recent veneer case, just showing the exact steps we do to make them have that beautiful, shiny surface finish. And this is a new video in my Dental Excellence series. I haven't created a YouTube dental excellence video in a long time, kind of got out of the process of doing this. And now that we've started our dental excellence newsletter, email newsletter, I wanted to start creating some dental excellence videos. And we had in my recent veneer webinar, a lot of questions about, provisional veneers. So today I'm going to show you how to make them look stunning. So let's look at the clinical video. So here you can see the preparations. This is the provisional veneer splinted, going into place. What I'll say is I could do another dental excellence video showing how I seat these provisional veneers. Just let me know in the comments if you'd like to see that. I have great video even of this case. So once we have it seated though, and we've cleaned up all the excess cement, provisional cement, I'm basically removing excess cement and polishing it initially with an enhance cup. The enhance cup allows me to shape and remove excess cement really easily. And it's usually pretty kind to the adjacent tissue. This is an 8-unit veneer provisional. And I can get a pretty good surface finish with the enhance cup. It's got a slight gloss to it, but then to really take it to another level, I'm using these rubber finishing wheels on a slow speed. And usually this is a 2-step process. I'll show you after this which system we're using for this. And you can see the second step of this leaves us with a pretty good finish. It's got a somewhat of a low luster. It looks pretty good. And this is Luxatemp, by the way. We get asked that as well. So here's the finish. Looks good. This would be acceptable for most cases, but I'd like to take my veneer provisionals to another level and have the patients, friends and family think they're the actual final veneers. So we dry this thoroughly. We need it really dry to apply this glaze solution. Now the glaze that I'm going to use is called Glycerin. With veneers, I apply it after the veneers are seated. So here's Glycerin from Clinician's Choice. I'm just applying it with a micro brush. Again, I do it after the veneers are seated because sometimes the cement needs to be polished and that removes the Glycerin. So we might as well just do this as a final step after any adjustments, after the veneers are seated. I'm applying it first in a pretty thick coating with the larger micro brush. And then I'm going to go in with the smaller micro brush because I find it pools interproximally and doesn't look as good. You could probably do this with just drying out your bigger micro brush, but here's the smaller one. I can get into better areas closer gingivally and remove any pooling interproximally. So that's why I switched to the smaller micro brush. Then we're going to light cure this extensively. I'm not going to show you the entire light curing process, but at this point, now we're going to do a really good trick, because if you don't do this, you have an oxygen inhibition layer on the Glycerin in any of these glazes, and it can stain. So what we are doing is we're applying liquid glycerin to the entire surface of the provisional, and then we're going to light cure again. And that's really the critical step, because when you apply the liquid glycerin, you're blocking out the oxygen inhibition layer and you can fully cure the surface of the Glycerin. And that gives you that porcelain-like finish that doesn't stain. If you don't do this, food will stain the Glycerin because it's got that tacky surface finish. And you can't fully cure it without an air blocking solution. So liquid glycerin, we buy a jar of glycerin from the liquid glycerin from the pharmacy, and we put it in those little syringes and just put it on with that. So here you can see I'm just applying it with the syringe, and then I'm just using my finger to make sure it's on all the surfaces. And then we light cure. So we light cure this extensively. More than I'm showing, I'm cutting out the light curing. You don't want to watch the light curing. But look at how the surface looks now. It looks way better than before the application of the liquid glycerin. It's shiny and just smooth and beautiful like a porcelain finish. And this is just a veneer provisional. You can see I was taking a picture with my iPhone. And this is what it looks like. This is what you can achieve with an extra 5-minute step. This is nothing as far as the grand scheme of your appointment. And the patient then, their family, their friends, themselves feels like they have final restoration other than being splinted. And monochromatic, of course. So here's what they look like when finished. I will point out I am planning to do the lower 6 anteriors. That's actually this week. We're going to prep those. So we just didn't do it all at once. So I'd highly recommend you consider using Glycerin and follow my system with Glycerin to block out the air inhibition layer, oxygen inhibition layer. And so here's Glycerin. This is from Clinician's Choice. I'll actually put a link to the US site, at least, on the description below in YouTube. And here is the polisher that I was using. It's a 2-step composite intraoral polisher. This is Diacomp from Brasler. And this is a great little polishing system. You can also use the ASAP polishers from Clinician's Choice. I have both. I asked my assistant which one we were using in that video, and it was the Diacomp. So either works. I think they're both really good. Here's the the veneer preparations. You can see we've prepared these very, very conservatively. I used a mock-up and then depth cuts in the mock-up to ensure that I had the correct dimensions to the preparations, while conserving almost entirely enamel, except for this little tiny bit of exposed dent in here. We did break contact here because she had a diastema that was closed with a composite. The rest of it, we didn't break contact anywhere. That's usually my option of choice when I'm making porcelain veneers, that I'd like to be conservative. This patient wanted her teeth significantly longer. You can see her full smile. She shows the teeth. But when she's talking, her lip has a lot of mobility. When she's speaking, she was losing the tooth display that she wanted to have. And so we lengthened them. She's tested them now for 2 weeks. I'm going to see her on Wednesday this week and see, whether or not she wants me to adjust them. We made them, 1.5 millimeters roughly longer, which followed what she wanted. But I have the patient check it out, test it. The speech was good, but this is a subjective criteria. Is this the length she wants? It is the shape she wanted. She wanted them quite square, but if she finds they're too long, I can shorten them slightly with Softflex XT discs, and that's not a problem. But with her lip at rest, she now shows some tooth display. I'll maybe take some video and show that in a future video, or at least during my occlusion design member webinars. I showed this case last month. And basically, we can look at what we want to do with the incisal edge position. So this is what she desired. We did a mock-up. She liked it, but I wanted her to test it out because it's a pretty significant length increase. And you can see another video here.
I think you're going to be really happy with these.
Mm-hmm.
Again, what she wanted was more tooth display and more fullness to support her lip. And that's just the little video I was taking with my iPhone. And then you can see the before and the provisionals. And these were posted on my Instagram stories. So that's it for this Dental Excellence video. If you'd like to see other veneer provisional videos, some other ideas and techniques about provisional veneers, let me know in the comments below, and I might be able to make some other Dental Excellence videos on this subject. And just before I go, just remember, you can do this kind of dentistry. Beautiful dentistry with precise fit and occlusion is not just for the gurus. You can do this. And we'll talk to you soon. Take care.